Hello coders. Nowadays, as all of us know, there is a huge demand for inpatient medical coding jobs, or usually we'll call it as inpatient medical coder. If you are a inpatient medical coder, most of the companies are providing work from home opportunities as well as huge salaries. So most of the coders who are having minimum 5 years experience in medical coding, irrespective of specialty, trying to enter into medical coding, especially into inpatient medical coding. But most of the people are trying to enter into medical coding, but they don't know the basics about inpatient medical coding. So here I am going to help you with providing inpatient medical coding basics, which you will use during the interviews as well as the live coding of inpatient coding charts. So this session is useful for the coders who are trying to enter inpatient medical coding as well as the coders who are already working as a inpatient medical coders. Basically, this is like refreshment session for experienced inpatient medical coders. So as all of us know, in inpatient coding, payment depends on the DRGs. So DRG depends on principal diagnosis. And this principal diagnosis depends on UHDDS. So basically, the full form of UHDDS is Uniform Hospital Discharge Data Set. Using this data set, we are going to code inpatient medical coding charts. In this session, we are going to know all the elements which are related to UHDDS, and also we are going to know what is the purpose of UHDDS. So please watch, like, comment, share and subscribe our channel so that we will provide more valuable inpatient related medical coding videos. First, we need to know UHDDS. So basically, Uniform Hospital Discharge Set, which is referred to as the UHDDS, is the core data set for inpatient admissions. So here basically you need to understand that. So we will use UHDDS data set for only inpatient admissions. Usually the data is collected on inpatient hospital discharges for Medicare and Medicaid programs. And where do you find this data set? So usually you will find UHDDS DDS data set in the patient's face sheet. The goal of UHDDS is to obtain uniform comparable discharge data on all inpatients. So basically in using the UHDDS, we are going to get uniform hospital discharge data set on all the inpatient admission. So if we follow one same type of data sets for each and every inpatient admission, it is easy to understand the statistics related to the inpatient coding or inpatient admissions. Majorly, the elements are categorized into four types. So patient identification, provider information, clinical information of the patient, episode of care, and financial information. So basically, in the first category, we will identify patient identification like patient's name, age, and social security number, like that. Next, provider information. Using this category, we will identify provider credentials as well as the provider identification number. So next third one is clinical information of the patient episode of care. So using this data element, we will identify patients or reason for the patient's admission as well as treatment received by the patient during the hospital inpatient stay. Next one is financial information. So using this last and fourth category, we are going to know the insurance related to that specific patient whenever he will admit as a inpatient. So and also we'll use this UHDDS for reporting inpatient data in acute care, short-term care and long-term care hospital. So basically UHDDS is not useful for outpatient. So it is exclusively useful for acute care, short-term care and long-term care hospitals, which will comes under inpatient. So next, minimum set of items based on a standard definition to provide consistent data for multiple users. So next, required for reporting Medicare and Medicaid patients. So in order to report for Medicare or Medicare patients, we need to use the UHDDS in order to code inpatient live charts. So as UHDDS system is the standardized procedure for inpatient hospital stay, so most of the private payers also are using UHDDS for uniform billing system. So now we will check what are UHDDS items which are very essential in order to code inpatient live coding chart using ICD-10 CM as well as ICD-10 PCS. First one is personal identification or unique identifier. So the primary identifier is used by the facility to identify the patient at admission using the medical record number. So basically, in order to follow UHDDS, we need to have the medical record number of the patient. So using this medical record number, we will identify the patient easily. Next, we need to have the patient name. So this is one of the item of UHDDS. Under UHDDS, you need to provide personal identification number as well as the patient name. So here you are going to mention or you are going to check patient's legal name including surname, given name, middle name or initial. So based on the patient's name, you need to choose the correct patient while live coding. Next, we need to check for patient's date of birth. So this should be in the form of year, month, day of birth, like first voice and month and days. Next UHDDS item is gender. So this should be noted as male, female, unknown or undetermined. So these are the standardized items for UHDDS inpatient chart coding. Next we need to check for race and ethnicity. So basically this race is useful for the government in order to check statistical purpose like American Indian or Alaskan Native, Asian or Pacific Islander, black, white and unknown. So using the race, you government will take the statistics from those data element. Next is ethnicity. So here examples for ethnicities are Hispanic origin or not of Hispanic origin and unknown. Next one is residence. So this is the one of the most important UHDDS item. So residence. So this consists of patient's address or location of residence. So the residence components include street address, city, state, province, zip or postal code, country and type of address such as permanent or mailing. So using this component of UHDDS, we will check for residence of the patient. So if you like this session, please click on like button in order to motivate me and in order to provide more valuable inpatient medical coding videos related to Navy or experienced medical coders. So next UHDDS item is healthcare facility identification number. So basically like patient, even healthcare facility needs to have its number if you follow the UHDDS items or UHDDS inpatient coding guidelines. Next, we need to check for admission date and type of admission. So a categorization of the encounter such as emergency, inpatient, outpatient, home care, blah 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 like that. So we need to check for admission date and type of admission, whether patient is admitted as emergency or directly patient is admitted as inpatient or outpatient like that. So next one is discharge date, the date the actual patient actually left the facility or died. So UHDDS items contains discharge date which is most important. Why means as all of us know in inpatient coding, so we will code based on the number of days patients stay in the hospital. So admission date and discharge date are most important in order to code in inpatient live coding charts. Next one is attending physician identification. Like healthcare facility identification, we need to identify the facility to identify the physician. And we need to use physician or primary identifier. Next one is surgeon identification. The primary identifier is used by the facility to identify the patient at surgeon. So now we are going to discuss most important parts of UHDD as items which we need to use while coding inpatient live coding charts. So first one is principal diagnosis. So the principal diagnosis is defined as the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital care. So basically one of the most important UHDDS item we need to concentrate more on principal diagnosis. Why means most of the inpatient admissions based on the principal diagnosis where based on diagnosis we will append DRGs. So based on DRGs physician or hospital or facility will get the payment. So here principal diagnosis very important component of UHDDS items. Anyway you no need to worry. So next week after few days I am going to post one video related to how to choose principal diagnosis. There you are going to clear all your confusion. So next one is other diagnosis. So other diagnosis consists of additional diagnosis for which the patient received treatment for and consist of complications and comorbidities. Like other diagnosis consist of which conditions patient has received the treatment as well as CCs and MCCs. So usually CC means complication comorbidities, MCC means major complications and comorbidities. Next one is principal procedures and date. So basically the principal procedure can be defined as a procedure that is performed for therapeutic reasons rather than diagnostic purpose or treat complication or that procedure which is most closely related to the principal diagnosis. So basically in inpatient coding we will code for therapeutic procedures not diagnostic purposes or procedure. Next one is other procedures and dates. So other procedure can be defined as additional procedure performed during the inpatient admission. So while coding inpatient coding live chat, along with the principal procedure and date, we need to code like other procedure and dates based on the medical necessity. So using the patient's condition as well as the performed procedure, we will maintain or we will relate the medical necessity for the procedure. Next most important UHDDS item is disposition of patient at discharge. So basically where the patient is going to discharge. So here we are having few examples related to that whether patient is going to discharge to home or to any other acute care hospital or nursing facility. So we need to check all these discharge status. So why means based on the discharge status facilities or hospital will get the payment. So while coding live chats patient's discharge status is also very important. We need to check in the documentation and we need to ensure we are coding exact dispatch or discharge status. So next one is expected payer of most of this bill. So here we need to check our facility will bill for the services that were provided to the patient. So obviously, so if the facility treats patient means facility needs to get the amount for treatment provided to the patient. So next one is total charges for the services provided by the facility. So here this item includes in the UHDDS items. So basically these are the basics in order to code the inpatient live coding chats. So I hope this session is very useful for you. I hope you have learned something related to UHDDS. So if you are a fresher, you can use this video as a learning purpose. If you are an experienced coder, this you can use as a refresher. So you don't need to worry. So after this session, we are going to discuss about how to select principal diagnosis using the example scenarios. So thanks for visiting FastCoder 21. Please like, comment, share and subscribe FastCoder 21. So and also we will provide trainings related to same day surgery, CPC and CPM certifications. So if anyone interested to undergo same day surgery training, CPC or CPMA certification training, please contact us using Vincent Medical Coder at the rate of gmail.com.